Greetings, this is the coronavirus update for 3/31/2020, the never forget version. This is not a joke or an exaggeration. The 9/11 attack of 2001 left 2,996 Americans dead, and the CDC incompetence of 2020 has now left 3,873 Americans dead because of incompetence and lack of being prepared. So let's take a look back at 2/21/2020 when the United States had 16 cases, and this was up from 14 the day before, and 14 was the number for maybe 5 days in a row. Now we're up to 16 because of a new case in Texas and another case in the LA area, I believe, if I remember that correctly. In the meantime, China is at 76,727, and they're going to peak at 82,000. So China, at this point in time, almost has the virus contained. In the meantime, the United States is in a position to have the virus contained, but they failed. So this 16 cases includes the early cases of a guy in Seattle, which is covered in other videos, another in LA, and students in University of Wisconsin-Madison and in Boston. These were people that were included in that first 16. At this point in time, China had already brought in the army to help in testing. Unfortunately, China sent in the army to help in testing without adequate protection gear, and this was one of China's huge mistakes that they made. They let the army, first 1,700 people infected, and then it went up to 3,000, and many, many deaths because the Army actually had, some protective gear, but they weren't trained in how to use it. They weren't protecting themselves very well, and they were working in makeshift hospitals. And China had already gone crazy disinfecting swaths of the country, the city of Wuhan. At this point, the CDC should have been testing everyone who was on an airplane with these 16 people, because the first case, which was in Seattle, was a 35-year-old Chinese-American guy who went to Wuhan for the Chinese New Year, and then he returned. And after returning, a few days later, he started to develop symptoms, and he went into an urgent care facility, and then he became our first patient. He went into critical condition, right away because he didn't get treatment for a while. So the CDC should have been verifying everyone who was on an airplane with these 16 people, as other countries were doing. But the issue was the CDC didn't have enough tests, which is crazy. This is the Center for Disease Control, not the Center for Disease Watching It Spread. Control. They didn't have a plan. But the CDC did not have enough test kits, so they published a testing criteria that mandated that all people who were tested had to have been in Wuhan or in contact with somebody who was in Wuhan. This was the criteria in the early days, back when we had 16 cases. Then it was discovered that the test kits were flawed, so the CDC put out a message not to use the test kits. This was a point in time that tens of thousands of Americans were just doomed. What do we do now? We don't have any test kits. The CDC is a little laboratory, and it's an office in Atlanta, but it's also a little laboratory that's incapable of producing a large number of test kits. What were these people thinking? You got to wonder, what could you be thinking with, anybody with just average intelligence would have known. You watch these doomsday, programs on the Smithsonian Channel and Discovery channels and stuff like that, where, always one of the doomsday scenarios is a virus. And you read about virus X, the one that's going to wipe out humanity. The CDC should have had a plan for this. So here's the issue. The CDC was prepared for this. 27 U.S. cases of SARS on the left. You can see China 5,300 cases. I remember when China surpassed that. It was pretty early in the coronavirus era. So 27 total cases in the United States of SARS. On the right, MERS. We had 2 cases of MERS. So the CDC was prepared for this with their, 1,000 tests, but they weren't prepared for anything else. I mean, it's not the Center for Disease Control of tiny little virus outbreaks. It's the Center for Disease Control. Yeah, this is crazy. These people, I've been saying in every video, the CDC just smokes crack all day. They have to. Either that or they're the dumbest people on the planet. But there was no CDC plan for a pandemic. Not at all. Nothing. Nada. So here's a graphic from other videos of mine. It kind of shows you graphically or pictorially. These are 2 army trucks, military police with FDA on the side, which don't actually exist. I just put them there. And some army guys with an FDA on their vests, which I just put there too. So this just shows you that the FDA regulations were kind of a roadblock between the CDC and the thousands of university research institutes and hospital research institutes and private U.S. laboratories and foreign laboratories, because the FDA, had regulations about using, test kits made from these private labs and university labs and hospital labs. The regulations just, wouldn't allow these laboratories, these thousands of laboratories who were quite capable of making test kits. Regulations prevented them from doing so. We only had the CDC to rely on, a tiny little organization that likes to toot their own horn and, visit other countries and, set up CDC organizations in other countries, and just, they're all there for, show. It's a smoke and mirror show, because it actually, back in the United States, they're not prepared for a pandemic. They have no way of producing test kits. Duh. So the CDC was highly aware of the fact that FDA regulations prevented thousands of American research institutes and private labs from making test kits. They were aware of this for decades. Now, if you were in the CDC and you had a brain and you knew something about the business world, wouldn't you think ahead and think, what's going to happen if a pandemic hits? So what was the CDC plan for an adequate supply of test kits? Are they just banking, America's future on having virus outbreaks that, are under 100 for a whole country? Is that what their mode of operation is? We're the center of disease control for little tiny outbreaks. You're on your own if there's a big outbreak. Were American hospitals prepared for the pandemic? Yes, American hospitals were prepared. American hospitals are prepared for a lot of things. You've probably seen your local news channels covering a hospital doing a drill for like mass injuries due to something like an earthquake or, something like 9/11, where they have a bunch of people that are, set up in various, outdoor locations who are injured, and the hospital does a drill just, I've been a federal government consultant for a long time, and this would be like what we call a stress test to see what the system can handle as far as volume. Can the system handle a volume of, thousands of people being injured or thousands of people being infected with an infectious disease? Yes, the hospitals were prepared. This is a 60 Minutes program that featured one of the world's leading hospitals, Johns Hopkins, who invited medical professionals across the world to participate in a seminar that predicted a global pandemic. So this is like a drill that the hospitals had, and this was done by Johns Hopkins. China sent the heads of the Chinese infectious disease organizations there. Many other countries sent their infectious disease experts. The following screens are taken from the 60-minute program. So these are screen prints from this program, 60 Minutes, which is a very interesting program if you want to watch it. Hanging on the left is now famous Johns Hopkins Coronavirus Global Tracker, which I've been using for quite a while here. Done by the Center for System Science and Engineering. I actually worked at Johns Hopkins, but it wasn't this research institute. On the right is the virus suits with oxygen supply. So, if you take a look at these, this is a dummy that they're using for a patient on the right, but these are virus outfits that are sealed. They're well prepared. They have, self-contained oxygen supplies. Probably the hoses on their back of their heads would go directly to the oxygen outlets on the wall. But they are very prepared to, deal with this. They have drills, and that drill on the right with a dummy is, a drill on how to care for a patient. So I'm sure that, good part of this, staff people at Johns Hopkins Hospital, would be going through this virus training. If you take a look at the pictures on the left, you see these virus outfits again, which look to be very adequate, sealing off a hospital person, nurses and doctors, on the front line. And also on the left, I just noticed this, but there's a Purell hand sanitizer thing there. If you've been in the hospital lately, you see these Purell things on both sides of the elevator when you first walk in the hospital. And in the offices where a doctor is going to, come and greet you, the doctor will have to clean their hands with Purell before they meet you and then before they leave the room, and then you get a questionnaire afterwards. This is the Cleveland Clinic, my hospital. And this Purell happens to be made in Akron, but that's not the reason that it dominates hospitals. It's just it's made by a company that makes other industrial stuff for the medical industry and for industry. And on the right, you see a guy from China. This is, one of the Chinese heads of infectious diseases in China. So this was a big seminar that was being put on here, and they predicted a lot of things that would happen. They predicted, shortages of hospital equipment and shortages of hospital beds, to treat a pandemic, a major pandemic, because the world hasn't seen a major pandemic since the Spanish flu and the plague. we haven't seen a major pandemic in the last few decades. American hospitals were ready for a pandemic, kind of, but again, there was no guidance from the CDC about the business end. Do you have a inventory of enough personal protection gear? This is Johns Hopkins, and you wonder how many of these suits they have. Do they have enough for just people to wear today? What if there's a real pandemic? And also, Johns Hopkins has locations all over Baltimore. It's not just one location. There's Johns Hopkins Hospital and a few of them, and then there's Johns Hopkins University. So, how prepared were they as far as the volume of this personal protection gear? It turns out, and ventilators if you need them for patients. And we're seeing now that, there's a big shortage because the CDC didn't bother thinking about that. They're the Center for Disease Watching, pandemic watching. They're pandemic watchers. Was the lack of coronavirus testing real? Or is this just some kind of a hypothesis? Well, it's real according to the Washington Post. How U.S. coronavirus testing stalled. Flawed tests, red tape. Flawed tests is because, the initial tests sent out by the CDC were bad. They were faulty. Red tape means, the FDA. The FDA had to approve tests if they didn't come from the CDC. The CDC is a little tiny organization that sits in Atlanta and smokes crack and figures out ways to make their name known around the world and, spread their name. They don't really care about a real pandemic. And resistance to the millions of test kits provided by the WHO that came from a German company, 1.4 million test kits. We didn't want to use them. Why? This is just crazy. So this is the Washington Post. Again, Washington Post, 11 to 100,000. What went wrong with testing? Wall Street Journal, America needed coronavirus tests. The government failed. A lot of people blame this on the Trump administration, but, he didn't create the CDC. They were around since just after World War II. And, they just have been smoking crack that long. What went wrong with coronavirus testing in the U.S. from the New Yorker? New York Times, as coronavirus numbers rise, CDC testing comes under fire. Yeah, because you guys are involved in self-promotion. You don't really care about a real pandemic because you've never even thought of one. Look at the picture on the right. That's what we have now because of the CDC. We have Americans dying by the zillions now. Newsweek, U.S. coronavirus response and testing kit problems present a colossal failure. This is coming from the World Health Organization, and the article is by Newsweek. USA Today, coronavirus tests failing, leaves America flying blind through a pandemic. We just don't know who has a virus. There's not enough tests, to do. New York City just yesterday, the health department said that, testing should be used on patients inside of hospitals because we don't have enough tests. And inside of a hospital, we'd like to sort out the people suffering from from a regular flu outbreak, influenza, from the people who actually have COVID-19. That's kind of important to do in a hospital, but it's important to do in a community too. But there's no way we can do that in a community because we don't have enough tests. AP, Associated Press, testing blunders crippled U.S. responses. So here's NBC News. What do we have here on the left? Fauci, who is the head of the National Institute of Allergy and Infectious Diseases, which comes under the National Institute of Health. And he's, speaking before Congress here. And on the right is this German guy whose little laboratory made 1.4 million test kits for the World Health Organization. But the U.S. didn't have any way of, first, nobody asked for those tests. When the World Health Organization saw that the U.S., was failing because we don't have enough test kits, they said, hey, here's some test kits. And we said, duh. We're too busy smoking crack at the CDC, and who else is supposed to give you an approval to use those tests? We don't know. BBC, America's testing failure. Forbes, 6 reasons the CDC COVID-19 failure was predictable. Bloomberg, U.S. is lagging in coronavirus tests, and it's not even close. Yeah, it's not even close because China identified all these people. At this point in time, China had things under control. South Korea was in a pandemic, and they didn't get things under control yet, but they eventually did. And it only took them a few weeks. I have another video on South Korea that you should watch. South Korea is the model country in the world. NPR, National Public Radio, opinion, early coronavirus testing failures will cost lives. Most of these articles I pulled out by searching for this in a specific time period, and that time period was March 10th through March 15th, when people started realizing that it's the failure or the issue of not having enough test kits that's going to kill a lot of Americans. MIT, why does CDC botch this coronavirus testing? It's the CDC. Whatever you hear elsewhere, it's not Trump, it's not anything. It's not any specific hospitals, it's not governors, it's not mayors. It's the CDC. They had no plan. They're the center of disease pandemic watching. That's what they do. They smoke crack and they watch pandemics. MIT, What the hell is going on with coronavirus testing in the U.S.? Nothing's going on. The Atlantic, 4 key reasons the U.S. is so behind on coronavirus testing. CDC, CDC, and the CDC, and the CDC. That's the 4 reasons. How testing failures allowed coronavirus to sweep in the United States. Politico. Mercury News, San Francisco Bay. These guys have been publishing a lot of stuff. CDC's coronavirus testing failure is a national outrage. It's an outrage, and everybody should be outraged at this. You know, look at the map on the right. That's a gift from the CDC. Science magazine, the United States badly bungled coronavirus testing, but things may improve soon. And again, these are, this one's from February 28th. Things didn't improve very soon because it's the end of March now. Top health official Fauci, people in the U.S. not easily getting coronavirus testing is a failing. It's a failure. It's a failure by the CDC because there was no plan. America botched coronavirus testing. We're about to find out just how badly. It looks like another Italian-style disaster, says the Daily Beast. Snopes. Did U.S. refuse COVID-19 testing kits from the World Health Organization? Yeah, because because the CDC knew for decades that the regulations of the FDA wouldn't allow, test kits to come from private testing labs or from foreign labs, or the FDA had regulations against it. Maybe there was a reason to have regulations against it, but that means you have to depend on the CDC to give you test kits. They don't have the capacity to make more than 100 test kits. I don't, it's just hard to fathom what these idiots, did for planning for a pandemic. Absolutely nothing. They're only interested in, spreading their own name across the world and, acting like a knight in shining armor, where they're actually the cause of this map on the right. So, never forget, 2,996 Americans died from Islamic extremists in one terrorist act in the United States. Now we're up to 3,873 Americans died and counting because the CDC was not prepared. They're the Center for Disease Control, but they're going to be known throughout history now as the Center for Disease Pandemic Watching because they did nothing. They don't have any kind of plan. We appreciate your time.